what I wanted to talk about today is what is Medicaid? What is North Carolina Health Choice? Because you hear that phrase too revolving around Medicaid. Some terminology with Medicaid that we use. Administering Medicaid. What does Medicaid and North Carolina Health Choice do? General eligibility requirements. And the difference between Medicare and Medicaid. And then I'll just touch a little bit on NC FAST and NC TRACS, which is the systems that we use for Medicaid eligibility and payments of Medicaid. So what is Medicaid? Well, Medicaid is a health insurance program that is for low-income individuals and for families who cannot afford their health insurance cost. So the applicant and beneficiaries for Medicaid, they must meet financial and non-financial criteria in order to be eligible for these programs. And like any other medical insurance, it covers the cost of their medical needs and related expenses for those individuals who are actually eligible for it. So the goal of Medicaid is to ensure that individuals are getting the quality health care that they need in order to keep them healthy and keep their lives long. Now, we also hear the words North Carolina Health Choice, and mainly that revolves around children. It's mainly a family and children's type program, and it is actually not a Medicaid program. It does not come from that pot of funds, so it's a little bit different. But it provides free or low-cost comprehensive health insurance to individuals whose family make too much money to be eligible for Medicaid, but they make too little money to afford the rising health insurance premiums that are out there today. So we offer this program in order to try to bridge that gap and meet that hole where some individuals fall into. And North Carolina Health Choice was basically introduced to ensure that children remained healthy in order to be ready to be able to learn effectively at school and to also get into the workforce and be able to remain healthy and continue their jobs. How is Medicaid administered? Well, the policy is governed by both federal and state regulations, and so we have two different sets of regulations that we have to put together and combine in order to administer Medicaid. And it's the responsibility of the Division of Health Benefits to make sure that these programs are being adhered to by the local county DSSs. So the local agencies are the one who actually determine the eligibility and administer the programs per se. They're the ones who deal with the beneficiaries, and they are the ones who determine the eligibility for their Medicaid. But it's the Division of Health Benefits to supervise them and to make sure that the programs and the policies are being adhered to. Now, with the Medicaid program, it's basically broken down into two categories. You have your family and children's Medicaid, and then you have your medical assistance for your age, blind, and disabled. And when you go into a local DSS agency, most of the time you're going to see that these units are broken out separately, and the same caseworkers do not determine the eligibility for both sets of programs because they are so vast and it requires such different requirements that it's too much for one individual to remember all of it. So when you walk into a local agency for a beneficiary, these programs are handled separately. So for your family and children's Medicaid programs, you have your medical assistance for your families, which is your MAF. And you'll hear us talk a lot about in the acronyms and use those symbols that we use for Medicaid. You have your medical assistance for your infants and children's, which is your MIC programs. Your medical for pregnant women, your MPW programs. Your breast and cervical cancer Medicaid, your family planning programs. Your adoption assistance Medicaid, and your state and foster home Medicaid. And then you have your medical assistance for your age, blind, and disabled folks. And that's your medical assistance for the age, the medical assistance for the blind, the medical assistance for the disabled, and then your qualified Medicare beneficiary programs. Now, what I wanted to talk to you about today, and I'm going to focus more, I'm not going to go into the side of the family and children's because I don't think it's pertinent to what we're talking about today. So I'm going to stick to the Medicaid for the age, blind, and disabled folks. So first of all, you have your medical assistance for the age. That's your MAA program, and that is for individuals who are age 65 and older. So if you're age 65 and older and you meet all other eligibility criteria, you will be put into the category of MAA. Then we have your medical assistance for the blind. In order to be eligible for medical assistance for the blind, you must meet Social Security's definition of blindness. And this can be for any age group. It doesn't necessarily have to be for an individual who is aged. This could be for a 20-year-old who meets that definition of blindness. They would receive MAB. Then you have your medical assistance for your disabled individuals, and this is for folks who are under the age of 65 and they have a disability. Of course, in order to receive this type of Medicaid for being disabled, they must meet Social Security's definition of disability, and then they would be classified as MAD. So those are your three main categories of your adult Medicaid. We also have the Qualified Medicare Beneficiaries Program. This is a limited coverage for your Medicare recipients. So in order to be eligible for this, you have to be receiving Medicare, and it's broken down into three categories. So you have your, what we call your MQBQ. With that program, it pays for not only your Medicare Part B premiums, but it also covers any co-payments that you have for with your Medicare plan and takes care of any deductibles. So it helps bridge that gap between what you're paying out of pocket and what Medicare is paying for. Then you have your MQBB and your MQBE, and they pay for your Medicare Part B premiums only. Now, one difference in these three is when you have MQBQ or MQBB, you can also be eligible for and receive full Medicaid. But if you're receiving full Medicaid, you cannot also receive MQBE. The income limit for MQBE is just a lot higher, and so they don't fall into that eligibility category, but we allow them to receive MQBE in order to help pay that cost and help reduce the out-of-pocket expenses that an individual has to pay for their Part B premiums. We also have some individuals who automatically receive Medicaid based on being approved for and receiving assistance in other programs that they've applied for. You have your state and county special assistants. This is your SA folks. These are your individuals who are in an adult care home or those who are at risk of being placed in an adult care home. They're receiving SA in-home. So what they do is that is administered by this program is administered by the local agency, and they actually receive a payment to either pay for being in an adult care home, or they receive a payment to help keep them at home and not have to be placed in the facility, which actually keeps costs low. And that way they're able to stay in their own environment and receive those benefits. So folks who are eligible for the SA program, for special assistance programs, they automatically receive Medicaid based on being eligible for this program. You also then have your supplemental security income folks, your SSI income folks. And this is administered by the federal government, and they actually receive an income, a payment, a check each month, and this is for those who are age blind or disabled individuals. Now these folks, if you automatically receive SSI, if you've applied for and approved and are receiving SSI, you're automatically eligible for Medicaid. So these folks are receiving Medicaid and they don't have to do anything further within the county DSS. So some high-level basic general eligibility criteria that individuals have to meet to be able to receive Medicaid. Well, first of all, you've got to be a resident of North Carolina. You've got to live here in North Carolina. And you have to be either a U.S. citizen or a qualified alien. Now, in some instances, if you're not a U.S. citizen and not a qualified alien, you may be able to receive coverage for emergency services only, and we send those up to a company and they determine if there is a life-threatening situation that these individuals would need coverage to help pay for this cost of care, but it's only for a very limited time frame, and they have to meet all other eligibility criteria. Now, folks who are lawfully here residing, they're a qualified alien. If they meet all other eligibility criteria, they can receive full coverage if they are pregnant or if they're a child under the age of 19. And then they're eligible as long as they meet all other eligibility criteria to receive full Medicaid coverage. Then other folks who are here lawfully can also be eligible either for full Medicaid, or they may only qualify for emergency services, which would be a life or death threatening type situation that they had charges for. Another criteria is they have to provide a Social Security number or apply for one, and the exception would be if they're an undocumented alien, they don't meet that requirement. We just look at them for emergency services only and determine all other eligibility criteria. Other criteria is you also cannot be incarcerated or a resident of a public institution. Now, individuals who are incarcerated in a state prison or in an institution for mental health, those individuals, we would take an application and actually determine their eligibility, but we would put them in what we call suspended status, and they would only be eligible for inpatient hospitalization care. And that would be all that Medicaid would cover for those folks. They also cannot be receiving Medicaid in another county or state. So if you're receiving Medicaid from South Carolina, then you're not eligible for North Carolina Medicaid. So it's only for North Carolina residents. And you also have to meet financial eligibility requirements, which means that you have to have, that your income and your assets, your resources, have to be below the allowable limits. And I've got a stack of some, for adult Medicaid, I didn't print off the family and children income limits, but I've got a stack that I can leave, and you're welcome to have one of those. It goes over the income limits. And this is actually will be effective April 1st of 2019. Now, we've actually made it really easy for somebody to access and apply for Medicaid benefits. So we offer various avenues in which an individual can apply for Medicaid. They can go through the federal marketplace, and when they go through the federal marketplace, it evaluates them and determines whether or not they may potentially meet Medicaid criteria, and it automatically sends to our NCFAS system, the system we work in at the agencies, an application, and we pull it up and we start working on the application that way. So they can go through the federal marketplace to determine if they're eligible for Medicaid. They can also go in person to a local agency, to a local DSS, and apply for Medicaid in person. They can mail it in to us. They can fax it in to us. We have e-pass system in which an individual can apply for Medicaid, and that system also allows you to apply for food and nutrition services as well. So they could use an e-pass application to apply for benefits. And then also we take a phone application on you. You can call into the agency, speak to a caseworker, they'll take your application. Of course, we still need your signature, so we'll mail it to you and then you sign it and send it back. We protect your date of application as the date of your phone interview. So that way you're not losing any days of potential benefits. So we offer all these avenues for somebody to be able to apply for and potentially receive Medicaid. So what does Medicaid pay for? Well, Medicaid pays for inpatient and outpatient hospital services, for your home health services, for mental health services, for your medicines, for your prescription drug charges. It also pays for your doctor's appointments, your durable medical equipment, dental services, routine eye services, and eyeglasses and visual aids. Now, I didn't specifically read off nursing home services or like physical, occupational, and speech therapies, because some of those get into your programs of community alternatives programs, your CAP programs, or your long-term care programs. Those programs require a little more extensive type of application in order to qualify for that type of Medicaid. And when we get into those higher level programs where the cost of care is very extensive and a lot, we have to look at transfer of assets evaluations and things like that. So it gets a little more tricky. But the basic stuff, and we're happy to say that routine eye exams and eyeglasses and visual aids is something that has expanded back into the adult Medicaid group, whereas it was very, very limited just very recently. That's just come out within the last month. Now, often many folks get confused about Medicare and Medicaid. When I was in the local agency, we got calls all the time from folks saying, hey, I need to speak to you about my Medicare. Well, we don't handle, social services didn't handle Medicare, we handled Medicaid. See, I even get confused. So I just wanted to make sure that everybody was aware of the differences between Medicaid and Medicare. So Medicaid is a public assistance program, and it is based on your income. So basically that's what it is, and it is governed though by federal and state regulations, but it is based on your income. It's a public assistance program. Medicare is an entitlement program. So that provides health coverage for individuals who are age 65 or older, or who meet being disabled regardless of their income. And that's federally administered. That's a federal program for that. Now, an individual can also receive both programs. They can be eligible for Medicare and also be eligible for Medicaid. And when that happens, we call those individuals a dual eligible, which means they're eligible for both. They're dually eligible, and they can receive that. And then just to let you know, Medicaid is always going to be the payer of last resort. So any other types of health insurance that they have, even Medicare, all of those insurances are going to pay first before Medicaid ever steps in and covers anything. Now the systems we work at, and I didn't have a slide for this, is NC Fast and NC Tracks. Well, the local agencies, we do all of our applications, our determining eligibility, we work within the NC Fast system, and that's how we operate. Then all that information and that data is transported over to NC Fast, and that's where providers actually go to bill for the services that the clients are receiving, and that's how the two systems talk and work. So that is briefly Medicaid 101.